Happy Sabbath, everyone, and welcome to this evening's presentation. This evening, we will be looking at constipation. What is it saying to us? Let us pray to begin. Our loving Father, we give you thanks for your grace, your mercy, your goodness. We thank you for your many, many blessings on us. And we thank you for the blessing of the Sabbath hours where we can put aside all the things that so easily beset us, and we will come before your presence to worship. I pray, Lord, as we look at this presentation, we will realize just how wonderfully and fearfully we were made, and that you have set every mechanism in place so that we can be perfectly whole. I pray, Lord, that you'll be with us and help us, that we will learn to love you more and appreciate our bodies even more. Thank you, Lord, for hearing us and for answering. In Jesus' name, amen. All right, so let us look. Now, I want to start by us looking at the part that has to do a lot with the topic that we are looking at, and that is our intestine. So that the length of the intestine is 7.5 meters from mouth to stomach, 5 meters from the end of the stomach to small intestine, and 1.5 meters from the end of small intestine to the end of the big or large intestine. So here's a picture of what your colon would look like. Oh, sorry. All right, so this is it. Now the part in here, you know, when I was back in high school, I always wonder why they're calling it large, small intestine, and when it is more, and the one that is on the outside that is so small, they call that one large intestine. I used to wonder about that until I recognized it was the size of the tube itself. All right, so for the younger ones who are there, this is a large intestine where your poop will come through. Okay, this is where the small one that you see mixed up in the middle there, that's where your food is digested and nutrients is taken from the body. All right. And then this large one, what is left, will go into this large one, and it will continue with taking out some other of the stuff that's there that's good for us. And what is left, the waste, will come through and pass from our body as waste. Okay, so that's a very wonderful natural process that the body will go through. Okay, but sometimes there's these intestinal disorders. Two most common intestinal disorders are related to the speed with which food travels through the intestines. All right, so there are two common things that will affect the intestine. There are many things, but two of the most common ones that we are looking at is the speed in which food will travel through these intestines that I just show you. If it goes too rapid, then you end up with diarrhea. So you have loss of water, loss of mineral salts, and there are other nutrients that are lost from the system also. Okay, that is when it is going too fast. When it is going too slow, it means that we are constipated. Diarrhea is a form of constipation too. Okay, the feces putrefy and produce toxic substances, resulting in a state of auto-intoxication of the body. So we don't want the body to be going too slow, and we take in the food, the waste is there, and it is just sitting in our system and can't come out. All right, God has not designed our bodies to work that way. It must be eliminated as long as it is waste. Constipation is one of those topics few like to talk about. So I tell you, it was a wonderful topic that we are doing. It can be both painful and frustrating. Almost everyone gets constipated at some time during his or her life. Women and the elderly are more commonly affected. Okay, ladies, we are more prone, and as we get older, when the colon start slowing down its operation, it will affect us even more. Okay, what is constipation? It is a slow, difficult transit of the contents of the intestine with infrequent evacuations and excessively firm feces. All right, so look at the description to know if it is constipation you're having. It is slow. It is a difficult transit to get the thing out of the colon. And there's infrequent evacuation, meaning that when you sit, sometimes you feel what we call ghost poo, meaning that you feel the urge to go, but when you go, nothing is coming. All right. And sometimes when it comes, is excessively firm, hard, so that it is hurting the buttocks. All right. The normal length of time between bowel movements range widely from person to person. All right. So look at this one. This is what constipation can be like sometimes. If you look at this, you notice that there's no water. This look like goat pellet. The water is completely dried out. The system, the body has a hard time trying to completely evacuate. So sometimes when you feel the need to go and you go, only little pieces of thing get out of your system, and all of this backup remain in the colon. That's a dreaded place to be. Okay. So we are going to look at some of the ways in which we can help ourselves, because these are waste. This is waste products. And if it is waste, it means that waste does not or should not be staying in your body. It must be leaving you because of the toxic nature of what is staying inside. You end up with a lot of different sickness, and we'll look at some of them. All right. Some people have bowel movements 3 times a day, others only 1 or 2 times a week. Going longer than 3 days without a bowel movement is too long. After 3 days, the stool or feces become harder and more difficult to pass. All right. I know there are some persons who say, well, I only go out once per week, or another one and say, well, it's only 2 times for the week. And they have been like that for a long time, and they have accepted themselves that this is just how it is, and that's how it's going to be. All right. It's not the best situation to be in. So are you constipated? So let me ask now, you tell me, are you constipated? You are considered constipated if you have 2 or more of the following for at least 3 months. Straining during a bowel movement more than 25% of the time. All right, so you're going to tell if you have that, nobody like to admit that this is going on, Hard stool more than 25% of the time. Incomplete evacuation more than 25% of the time. 2 or fewer bowel movements in a week. Now, the one that talk about the incomplete evacuation is something that we have to look carefully into, because sometimes you go to the toilet and you might be going all the time, but every time you go, you always feel as if there is something else that needs to come and it's not coming. All right. It is not a complete evacuation. So you feel that urge, you go, and when you go, you still have that urge as if you need to go again, as if you did not complete. Do you know what the Lord has blessed us with is something that we call the firing of the vagus nerve. So the Lord has blessed the lower part of our rectum with some nerves down there that are called vagus nerves. And when you have a good evacuation, it becomes an moment, you feel that satisfaction, that fulfillment that you have gone and you have done it and you have emptied yourself. Okay. So it gives you a aha moment. And if we are not getting that aha moment, it is because, it is not doing what it is supposed to be doing. Okay. So what are some of these symptoms? Infrequent bowel movements are difficulty having bowel movements. So either it is very infrequent or you're having difficulty passing. It can be hard or small stools, sense of incomplete bowel movement, swollen abdomen or abdominal pain. And you can have pain anywhere in the abdomen, on the right side, or pain in the lower back. Sometimes it might express itself in vomiting, occasional diarrhea resulting from hard stool obstructing the colon. All right. So even your diarrhea can be a sign of constipation. Depends on what else is going on. The vast majority of patients with constipations do not have any obvious illness to explain their symptoms and suffer from one of two problems. So you can have colonic inertia, a condition in which the colon contracts poorly and retains the stool. Now, this is one of the things that happen to us as we get older. You'll find that you don't go out as easily as you did in your younger days. Okay, and then you can have the obstructed defecation, and this is a condition in which the person excessively strain to expel stool from the rectum. So you feel that need to go, but when you go, it is not happening, and therefore you have to strain. This is not very good for us, because when we do that, it can lead to rupture in the rectal area. It can lead to hernia. It can lead to polyps. It can lead to hemorrhoids and many other things. All right. Atony or weakness in the muscles of the large intestine. Now, persons who are given into like colonic cleanse, they tend to, the muscles of the large intestine tend to go weaker. All right. And after a time, it just cannot do the function that it is supposed to do. Obstruction due to cancer of the colon or rectum. So persons who have rectal cancer might find it very hard to pass their stool. What can cause weakness of the intestine? An improper diet. Now, this is something that cannot be overemphasized. We have to look carefully at how we eat. Is there fiber in your food? All right, are you taking enough waters? Because your improper diet, your insufficient water intake, your insufficient fiber intake, eating large amounts of dairy products, the intestinal lining is not stimulated, and therefore it becomes weakened. So if you like your white bread, white flour, white rice, and those things, and then you like having the meats, these do not have fiber, and the transit time of meat in the colon is very, very slow. Okay, so we are setting up ourselves that way if we don't have things that are bulky. So like your whole grain, and by your whole grain, we are talking about like your oats and your millets, your quinoas, your bulgur, your cornmeal, whole grain cornmeal, your ground foods. Okay, these are better food to take in the system. Irregular bowel habits, what can cause it? Not setting a time or forming a routine to defecate. Do you have a time that you go to the toilet? You can literally set it, you know. You can wake up in the morning and go sit on the toilet. Say you want to make it a 5 o'clock habit. If you go and you sit there a few times every morning, religiously, you just go and you will sit on the toilet at the 5 o'clock. After a time, what is going to happen? I think the brain going to click in and say, you know what? I think my owner is losing her mind or his mind, because I do not feel to go out, but every morning religiously, this is what she does. So just in case they might give me some medication, think I have gone off my rockers, I will ensure something happens. So the brain kick in, and it will just decide that, okay, since she's doing this every minute, a routine need to be set. After a time, the routine is so set that even when you don't want to wake up in the morning, that belly is going to tell you that it's time to go out, all right? So you need to set a time and form a routine for defecation. A disruption of regular diet or routine, such as traveling, this can cause it to happen. Like most times when we were younger and we used to go to camp, most of us at camp, we come back constipated because we would not use the toilet at the camp. It was just too crowded, and it was just not home. All right, so we end up with problems. So your regular schedule, if it goes out of the routine that is set, this can also cause constipation. If you have nervous tension, it can cause either constipation, withholding of that, because they are tightening up, Or you can become so nervous that you can go the other end. You become with a very low stool. All right. If you are stressed, if you are hurrying, most time when persons are hurrying, they want to hurry their body. I have to go to work. You go to the toilet, it's not happening same time. You decide that, you know, you have to go. So you get up. We don't have the time to sit and wait on it. All right. Resisting the urge to have a bowel movement, which is sometimes the result of pain from hemorrhoids. All right. Sometimes it is persons have hemorrhoids or other things going on in the rectal area, and they know that it's going to pain them when they use the toilet. So therefore, they avoid it as much as they possibly can because they are dreading the pain. It is possible to lose the intestinal reflex. Okay, there are conditions. All of these can cause the body not to be able to do what it has to do. All right, another thing is abuse of laxatives. Some person, because they're not going out very regular, they turn to laxative. And the regular use of this are such as Senapod and Cascara. They're wonderful herbs, but they were not made to replace what was natural for the body to do. So once in a while, it can be done. We have enemas, and enema is a natural thing to use in case of sickness. All right, it is in case of sickness and disease, and you have to work with something. But for the natural part of your body, use the body to let it do what it was made to do. Over time, this can weaken the bowel muscles. This produces a perpetual state of inflammation in the intestines, intestinal mucosa, which result in desensitizing it to normal stimuli. Okay, so if we regular will do these things, then the body cannot do what it's natural for it to do. So are enemas good to use? Ellen White, after visiting the treatment room of Paradise Valley Sanitarium in 1906, received a vision in the night that warned, there are men who make a specialty of treating the rectum, and some feel that they have been greatly benefited. But I've been instructed that this treatment, as well as many surgical operations, leaves with many a serious weakness. Rather, let patients be taught how to regulate the diet so that the living machinery of the whole being will work in harmony. All right. So as long as the body can work, let the body work. So you don't have to go and get a colon irrigation. We will use enemas if persons cannot help themselves and they have their backup, all right, of fecal matter. But don't just use it for the sheer heck of using it. All right, lack of physical exercise. The less we exercise, the more likely it will be that we'll become constipated. Inadequate activity or exercise or immobility. You see, if we're given into sitting a lot, it can lead to constipation. So if we are at our desk and we sit at our desk from early morning and we don't get up until night, or we stay there from 8 o'clock and we don't move again until about 12 o'clock. All right, the body is not being moved. We are sitting in an L shape. All right, the body, that can put a strain on the lower part of the abdomen and on the rectal area, and it can lead to constipation. Digestive walk for 15 to 30 minutes after each meal. This is necessary to stimulate the reflex to defecate. All right, so it is good when you eat. You don't say, oh, my belly is so full, I need to relax. And we just sit back and relax in ourselves. No, this can lead to weakening of the muscles in the lower part of the rectal area and can lead to constipation. Health issues. So persons with hypothyroidism, neurological conditions such as Parkinson's disease or multiple sclerosis, this can lead to constipation because of the weakening of the muscles. Irritable bowel syndrome, eating disorder, depression, pregnancy, and colon cancer. These are some issues that can cause us not to go out. Now, let's look at your medication. Antacid medicines containing calcium or aluminum can lead to constipation. Medicines, especially strong pain medicine, narcotics, and antidepressants, and those can also lead to constipation. In some cases, lack of good nerves and muscle function in the bowel may also be a cause of constipation. Exercise, I have known clients that when you tell them that, you say, listen, learn to walk, go for a walk 1 hour daily. And this has proven to be very helpful. All right, constipated for a while. Constipation is a new problem for you. You have blood in your stool. You are losing weight even though you are not dieting. You have severe pain with bowel movement. If you have constipation for more than 2 weeks, you should see a doctor so he or she can determine the source of your problem and treat it. If constipation is caused by colon cancer, early detection and treatment is very important because you can get help for it. So don't watch the things happening and you do nothing about it. Test your doctors may perform to diagnose the cause of your constipation include blood tests if an hormonal imbalance is suspected, barium studies to look for obstruction of the colon, and you can do a colonoscopy to look for obstruction of the colon. All right, so these are some of the tests that can happen. Now let's look at water. If you do not drink enough water, the body pulls it from where it can, such as from the feces. So if the body needs water, it is going to take the water and it's going to find anywhere that it can get the water so that it can maintain itself. Okay, and when the large intestine is there with the fecal matter and the water is there, it's going to take that polluted water. And now you understand how we can get sick with this also. Fiber. Plant-based food, after it has been digested, leave its fiber behind, which forms a bulk for stools. When fiber is lacking in the diet, the feces becomes hard and dry, causing the transit through the intestine to become difficult. All right? So we need to ensure that we have a plant-based diet that are rich in fruits and vegetables, your nuts, your grains, and we must be drinking our water. These provide that we are talking about your whole grains. So you see them here, all right? You're talking about your rice and your oats and your millets, your quinoa, black rice, all different kind, your bulgur, okay? These provide insoluble fiber, meaning that they are not broken down by the body, that retains water in the feces, thus softening them and improving their movement through the intestines. All right, so you see why it's good to have, and remember, all grain is different from all wheat. All right, all grain is the whole grain, those that are not separated. Your legumes, all right, fiber-rich legumes, they are a mild laxative. So if you're given in to eat your peas and your beans, all right, they're excellent ways of ensuring that you get some fiber. Another good food you can use is your prunes. Prunes contain pectin, a type of soluble fiber. It is soothing and has laxative properties. It also has substances that stimulate intestinal contractions. It helps to strengthen and re-educate the bowel. So use up your prunes. All right, get some prunes and use them because they will help you to become regular. Okay. Apples. There's a substance inside of your apple that's called pectin, and this is really very good. They help to regulate movement through the intestine, very effective with constipation as well as your diarrhea. So it is a balancer of the human system. The pectin is there to help to clean the system. 1 or 2 apples eaten on an empty stomach contribute to overcoming intestinal anatomy. All right, so you can take your apples, and it is really true that an apple a day can keep your doctor away. Grapes and raisins. These fight constipation because of the high fiber. It balances the intestinal flora, facilitate proper digestive function. Okay, So this is your grapes and your raisins. So you know that the raisins are made from the grape. They are dried grapes, okay? Another beautiful one is figs. Now, figs is one excellent food. Fresh or dried, when soaked, figs stimulate movement of feces in the intestines. All right. So most time we have the dried figs, and that's the one that we would have recommended to persons. Honey, the fructose in honey has laxative properties when it is not completely absorbed in the small intestine. All right. So it has a kind of laxative effect on the body also. All right. Avoid processed baked food, that is a white bread. These lack fiber. And remember, the whiter the bread, the sooner you are dead. Okay, so these things, no, make sure if you are having any of these kind of things, you have made them yourself and they are made with whole grains. Okay, move away from the white bread, the refined food that you are eating. Avoid these things. Avoid caffeine. And by caffeine, we are not only talking about coffee, because most of us will say we don't drink coffee. Okay, but your chocolate, your cocoa, your caffeine, your coffee, your soft drink. Do you know that like Mountain Dew, glucosade, which one again? Your Tang, your Kool-Aid, most of these, they have the effect of caffeine. All right, so we should not be taking those in our system. All right, these contains no fiber, disturb your intestinal function, it fosters constipation, and it has a dehydrating effect. So let me say, any food that have caffeine in it, all right, then that they tend to be drying, have a drying effect on the body. All right, so we want to avoid food that has caffeine. Okay, and as a matter of fact, try to avoid food that are stimulating to the body. Okay, so you want to, that's why we look at things like your ginger you use as a medicine, your cinnamon you use as a medicine, your nutmeg, that's a medicine. All right, chocolate as a substance in it that mimics the caffeine. So that is your anybody remember the name of it? The red. Anybody remember the name of what is you'll find in your chocolate and in your cocoa? In your coffee, you'd have your caffeine, and you'll find that in soft drink. I'm waiting for a student to type what is the name of this substance that would have found in chocolate. All right. Our meat and fish. No, remember, your meat contains absolutely no fiber. It causes small, hard feces and difficulty to move through the intestines. All right? So it causes small, hard feces and make it very difficult. Meat is hard to go through your intestines. I need you to remember that. Okay? And the residue of it can stay inside of you for a long time. It encourages putrefaction, getting rotten inside of you in the intestine, which can become toxic. Okay, so if you want to have clean colon, remember, try to go to a plant-based diet. Spices have a very negative effect on the human body. Peppers, chilies, and sauces, they irritate the mucosa of the rectum and anus and aggravates your hemorrhoids. Now, when you take it, imagine how hot pepper burn your mouth and you are sending it down first to your stomach. What is it going to do to your stomach? It doesn't lose its heat, you know. You think you get rid of it out of your mouth and it's cooled down. No, it is going in the same way. When it goes to your intestine, it has that fiery taste same way, and it is burning through your intestines. Okay, and when it goes to your rectum, I know you go to toilet and your bottom burn you just the same as well your mouth had burned you when you just did it. So it is telling you something that it actually goes through your system, burning your system. So we need to avoid the hot peppers. Avoid them because they are causing us Not only constipation, but a lot of other health conditions, including acid reflux. Okay, I'll take your questions at the end. Your sugar consumption of sweets make constipation worse. Okay, I remember one of the classes we did last year, my very well, student in learning, when they say yum, yum. All right, when they say all of this, but they are attractive to the eyes, but think of what they are doing inside of you. Okay, they can allow your constipation to get worse. All right, avoid milk and dairy products as they may be habit forming and also lead to constipation. No, educate the bowel. Laxatives, enemas, glycerin, suppositive may relieve an acute case of constipation. So you want to do something if it is not happening. If my clients come to us and it's not happening, I am going to find something on the shelf to give them because I need this thing out of them. No. You understand? So I'm going to get them something to use to get rid of it. But for the long-term benefit, because I wouldn't want to go keeping them on these things all the time that you have to use a suppository or use some other form of thing. Oh, by the way, while I'm at it, please do not take mineral oil if you're constipated. It's one of the worst things you can do for your body. All right, let me just drop that in just in case someone is using it. All right, very toxic and aggressive on the system. So for your long term, learn good toilet habits from childhood and educate the bowel. Do not ignore the physiological need to defecate. All right, sometimes it's not convenient where you are, but as soon as you get into a position that you can, go take advantage of it. Try to evacuate at the same time of the day. Perform some type of physical exercise. All right. I've seen persons cannot go out and we send them just go take a walk, drink your water and go for a walk. And they come back and they are able to have good bowel movement. Another thing you can do is drink a glass of warm. When you wake up in the morning, stimulate your bowel by drinking a glass of warm water. If your stomach is okay, then take your warm water with some lemon juice. If you are given into to stomach problem, then it is best that you just do the warm water. All right. Which is the other, hold on please. All right, do not ignore your physiological need. As we said, try to evacuate, train your body to have a go out time and perform your exercise. What should I do if I'm constipated? So it is happening. This is the situation I'm in. This is the situation that somebody is in at this time. What do we do? Let's look at it. If you are constipated, try the following. Drink 2 or 4 extra glasses of water a day, unless you're on fluid restriction, such as those persons who are kidney persons or other kind of condition that restrict your water intake. Try warm liquids, especially in the morning. Add fruits and vegetables to your diet. Please remember, you do not add them together at the same meal. All right, so you can add the fruits in the morning and vegetable in the afternoon. Eat prawns and or bran cereal, okay, and other whole grains. If needed, use a very mild stool softener or laxative, such as pericolis or milk of magnesia. Do not use laxative for more than 2 weeks without calling your doctor, as laxative overuse can aggravate your symptoms. Okay, so you do something in the short run, but you do not make it a habit. Your body is supposed to be in a position for you to go out. If you find that you're not having it happening, first thing you do, drink your water. The warm water in the morning is the best thing, and you take it as warm as you can possibly go. It is a very good stimulant for the system, and you go and you sit on your toilet. Okay, nothing is happening. Walk with your phone, walk with your devotional, walk with your Bible, walk with something, but develop a habit that the body can mimic. All right, so these are some of the ways that you can take. It is important that you deal with it, because there is no good health without good bowel health. Remember that. If the bowel is not working well, you will not have health. It doesn't matter the good food that you eat or the good drink that you drink. It doesn't matter what else. All right. You have to, if you have bad food and good elimination, you're in a better position than the person who have good food but poor elimination. Okay, so elimination is very crucial, because the things are backing up inside of us, and it will lead to many forms of diseases. It can, even your liver can become toxic because of it, and your kidneys are affected. Okay, so you need to look clearly into it. I think this is where I will end, and whatever question there might be, you can ask so that I can try and answer. You can type it in the chat, or you can just put up your hand. All right, so Michaela, is it only toxic because it relates to constipation? T Forbes, you got an A. You got an A. T Forbes, all right? The theobromine, all right? Some call it theobromine, okay? So you got, and that was it. That is the chemical that is in the chocolate that mimics the caffeine, okay? All right. So it is not only toxic because of constipation, as I just mentioned, it will also affect your liver, it affects your blood, it will affect your kidneys, it will affect even your breath if you are not using the toilet as you should. All right. Question say, what do you suggest for an amputee who is diabetic that sits and lay down all day to alleviate constipation? Get the person, if the person is it a complete amputation, can the person be able to go outside? If the person can't move any at all, then try and get the person outside in the sunlight. Another thing that you can do is to massage the tummy. Use the warm water, and you can massage the tummy that way. All right, that is helpful. Look at the diet and make sure that it's a high fiber diet for that person. Okay, so you can do that. And if that is not happening, and the person is backed up for a long time and you want them to move, then you can do the animal. And while they are doing the animal, it would have been good at that time to use a probiotic at the same time also. All right. Oh, let me mention also, many of us, because we have bad eating habits and bad eliminations going on, I would suggest that you get a good probiotic, and that you will take this, because many of us have leaky gut. One of these evenings, we are going to do leaky gut. Because we have these bad habits that's going on with us. The system, the digestive system is not happening as it should. And your probiotics will help you to do that. When we have our clients come and we are cleaning them up, one of the things they must get is probiotics. We give them the probiotics, as we find that this is very helpful. All right. Hemorrhoids, if you look at what we do for constipation and you put those in, that is one way of treating hemorrhoids. Another way is to ensure that you soak in warm vinegar. You have to soak warm vinegar in the night and warm Epsom salt water in the morning. All right. And Irish potato is also very good for drying and drying out that area. Also the castor oil, very good for the inflammation that is there. Okay. So those are some of the things you can do. Mineral oil is toxic to the body, as I said before, and should not be taken internally. All right. You can use the extra virgin cold pressed castor oil. Okay. And depending on your size and age, you can use a tablespoon or two based on what is going on. okay? But it's the extra virgin cold press. Don't use your normal Jamaican black castor oil because it's very potent. So get the milder form of castor oil to use. Let me see, what was the other question? Okay, so you said the person cannot walk. Well, do a stimulation. Use the warm water on the tummy and use the castor oil and or olive oil for that matter, and rub that tummy, rub it, massage it, give it good massage. All right, do the massage and see. Give the warm water in the mornings. All right, let the person keep drinking the warm water constantly, and then you do the massage on the tummy with the warm olive oil or warm castor oil. Okay, and if you find that the person is not going out, say within 2-3 days, what you do is just give them an enema and put some probiotics in it when you're doing that. Is it true that if you have loose stools, it could be constipation? Yes. So constipation can be either too hard or too soft. Okay. When you find it soft and it going on, you say, no, but this is diarrhea. No. Sometimes what the body is the irritation of the system. Let the body is causing it to spew out its content, because there is a transition time, and if the transition is not taking place, it can, one of the reasons for you having that loose stool could be that the body is actually infected, or the muscles are weakened, which would have been the situation a lot of time with the constipation. All right, so it can manifest itself that way. Also, there is the idea of leaky gut while the stool is loose. So there can be some allergies to some food. I would suggest that the person take some probiotics, and make sure you drink a lot of water. Do the fruits and vegetables, and please do the walk. All right. The Irish potato is used. There are some persons whose hemorrhoid affect them a great deal, and there might be bleeding. So what we do, use the Irish potato just like you would. You're making fries, and you would just insert it. You don't have to push it in anybody or push it in yourself. If you put it near to the head of the rectum, it actually works itself in. All right. So we have done it, and it has proven well. Okay, so that is something you can do also. But make sure once a person is having the hemorrhoids, then it is good to do the soak. The soak is very important during that time. All right, any more questions? Was everything clear? I think somebody's asking, can you take the castor oil? Yes, as I said, use the extra virgin cold press to drink. Okay. And I hope the person get the suggestion of how you can actually help your hemorrhoids. I think those are all the questions I had. The soak is put a quarter cup of vinegar in warm water, and sit in it, all right, for 10 minutes or thereabout. And what it will do, it will help to strengthen the muscle of the rectal area, and also help to dry the hemorrhoids. Okay, if you're doing the Epsom salt, it's the same procedure that you would have used to do it. All right, so that is to help with those persons who have the hemorrhoids. Okay, I think I am finished. Did I answer everybody's question? All right, I think I do. If you didn't hear your question answered, please put up your hand. Do it now or forever hold your peace. Okay, so as of tonight, we should start working on getting rid of our constipation, or checking yourself. Now, a good test that I use with my clients to determine whether or not they have to look at the transit time. I gave them a 3 + 6 spoon of charcoal, activated charcoal in a glass of water, and you take that at bedtime. No, what you're going to look for is how long it will take for the charcoal to be seen in the stool. Charcoal is not digested by the human body, all right? So what it will do, it will what we call absorb. It will take things onto itself. It will not let go anything, and it will your system, but it doesn't go very fast. So we see how long it will take a person before them to go to the toilet and their stool is black. And it will give us a fair idea of the transit time that they are having. Okay? All right. All right, one last question. How long do you keep the Irish potato in the rectum? Overnight. Just do it overnight. And you can work on it in the nights, okay? All right. Okay, I think that brings us to the end of this evening's presentation. I hope the information was helpful and that it helped us to learn a little way, we can deal with this situation that has plagued so many of God's children. I pray for you, God's richest blessing. Go